Well, we've been fortunate to come across a few findings relating to the cellular immunology of multiple sclerosis that I think has taught us as a community that it's not about a single type of cell, it's multiple different types of cells. It's about balances between subsets, some that are more activating and others that are more acquiescing, and that normally a balance is struck, except every once in a while it'll spill over into an autoimmune condition, in the case of MS, targeting, of course, the central nervous system, and that these interactions are relevant in the periphery, outside of the central nervous system, for the relapsing aspect of MS, but within the central nervous system, interactions and balances between immune cells that get in and brain cells are likely an important driver of the non-relapsing progressive aspect of MS. So we've learned some new things in terms of the conceptual framework of the cellular neuroimmunology of MS, but also that people are different. And that's one of the most important aspects that we try to tackle in terms of this heterogeneity. Why are people biologically different? Why do some people have more attacks, more rapid progression, and so on? And how can we actually measure that, given that both of those processes are mostly under the surface? And so we need markers that can detect what's going on, even if we can't measure it directly. And that is the realm of biomarkers, and we've been very actively trying to contribute in terms of trying to measure things biologically, whether it's in the blood or in the spinal fluid, that can help us understand the relative presence of each of these different processes, so that ideally we'd be able to say this individual at this point has this much of that, this much of the other, and this of course has important implications to the therapies that you might select, whether you'd continue with the therapy that you're on or switch it, and what perhaps to switch it to. Well, we've come a long, long way in terms of both understanding and targeting the relapsing biology aspect of MS. We have now treatments that are very effective at almost preventing them in the great majority of people, and in a very reasonable, safe way that's well tolerated. There still is the major unmet need of the non-relapsing progressive MS. I think as a community we might be on the cusp of a new generation of treatments that are for the first time able to target that, the Bruton tyrosine kinase inhibitors or the BTK inhibitors. But there's more to be done in terms of targeting the progressive aspects of MS even beyond that. I don't think it's the last cry, although it's very exciting. And of course, fixing things that are already injured. The field of repair is one that we still are relatively farther behind. We share that challenge across multiple areas of neurology where the central nervous system is injured. And so as a community and a community of communities, the goal will be to have a better understanding of how we can help fix things that are already injured and help people be the best that they can be. Well, it's a great honor to be a recipient of the Distal. It's following in the footsteps of really remarkable individuals in terms of their contributions over the years, starting with the late Don Patey in 1995, so we're 30 years later. And we've seen a transformation in the field, and to have had the opportunity to be even a small contributor to that, of course, is incredibly gratifying. And I think there's nothing more gratifying than when your peers basically are saying, you seem to be on the right track. And I think that's the main message, that I think all of us work hard, passionately. And so it's humbling and very, very rewarding to have that kind of recognition.